Dr. Moore, what precautions can adults with hypertension or congenital heart disease take during COVID-19?
The best advice is to follow the precautions, wear your mask, wash your hands, social distance, don't go into crowded situations, and take care of your underlying heart conditions the way you usually do. Take your medicine, your blood pressure medicine especially. Keep your doctor's appointments, keep your doctor's visits, and follow your doctor's advice. If your doctor tells you you need a procedure or an additional test or additional work, follow their advice.
Dr. Moore, could you touch on the importance of taking your medication and taking it as prescribed during this time?
Many of our heart patients are on blood thinners for various reasons. Atrial fibrillation, we often have patients on blood thinners to avoid the risk or to lower the risk of stroke. In patients who've had stents, they're on certain kinds of blood thinners. And one of the complications of COVID-19 is to form blood clots. It's common for patients with COVID-19 to present with blood clots in the lungs, heart attacks, strokes, and some studies have shown that it's actually fairly frequent for heart muscle damage to be found in patients who've had COVID-19. So my point is that if you're on a blood thinner for your heart, don't stop it. Continue it in the setting of the COVID crisis. And then if you have to be admitted to the hospital with COVID-19, they may or may not continue the medication. But there is evidence that these medications help reduce the risk of complications with the virus.
So what do I need to know about the coronavirus if I have high blood pressure, stress, or another heart condition?
There were certain blood pressure medications that people were worried about taking early on, but now it looks like the best policy, or for anybody having hypertension, is to do what you usually do in terms of taking care of your blood pressure. Take care of your blood pressure by taking your medication. That's critically important. And that's true in general of the other risk factors as well for the COVID-19 disease process.
Why is it important for a patient to get prompt care for a non-COVID-19 illness?
It's really a good question. I think early on, especially in the first few months of the coronavirus crisis, people were afraid to go to the doctor, afraid to go to the emergency room. And there was a study out of Milan, Italy, during the height of the crisis, published in the American Heart Association journal, that showed that on average, patients were presenting with their heart attacks about 15 hours later than they had been historically. And that is a critical time frame for dealing with a person's heart attack. In the first 4 hours, you lose about half of the heart muscle that's being jeopardized or being affected by blockage of an artery. Blockage of an artery is what causes a heart attack. People are still delaying their presentation, but I think it's much more commonly known that we are taking the proper precautions both in the hospital and in doctors' offices. We have not had any of our employees have acquire COVID-19 from a patient, nor are we aware of anybody of our patients getting COVID-19 from another patient. So it's important to follow all those proper precautions.
Would you suggest that heart and stroke patients continue their rehabilitation at this time?
That's a good question. For a while, the rehabilitation programs were shut down for fear of transmitting the virus, but more recently they've opened back up. And with proper precautions, social distancing, careful sanitation in between patients, and of course wearing the mask, I think cardiac rehabilitation and stroke rehabilitation is a critical part of the process of healing. And so, yes, I think time to go back to rehabilitation and continue the process.
So is it safe to have a heart procedure during COVID-19?
I think it's a good question. People, we have patients call the office and say, I really want to delay my procedure because I'm afraid of getting COVID or I'm afraid of getting out of the house. We have had patients who delayed procedures and had bad outcomes as a result of those delays. There are, again, very stringent precautions required and taken, partly for the protection of the staff and the physician, with procedures that cause aerosolization. That means mucus or contents of your oral cavity. If you have any chance of creating an aerosol or spray of that material, that jeopardizes all of the people around you. So there are certain procedures that we are requiring the patient to have a COVID, and the hospital is requiring them to have a COVID test several days in advance of the procedure to make sure that they're negative for COVID and that they can have the procedure safely.
Dr. Moore, how important is it that people wear a mask during this pandemic?
What's really critically important about wearing a mask is it helps protect the person wearing the mask, but even more importantly, it helps protect everybody around that person. And when you are speaking or coughing or sneezing or just breathing, you may be contaminating the air around you, and the mask markedly reduces the likelihood of that happening.
Dr. Moore, the public may be hearing different information on death rates as well as long-term effects. What are you seeing?
It is true that the death rates are thankfully lower than we anticipated they might be. The overall death rate is lower. The mortality associated with this disease is less than 5%, and we're getting better, again, at treating the disease if patients get in early on. But there is still the question of long-term sequelae, and in some studies I've seen recently, cardiac magnetic resonance imaging of the heart shows damage to the heart in anywhere between 50 and 70% of the patients who've had the COVID virus. It not only can affect the heart, but it can also affect the lungs, of course, and there's a question of interstitial fibrosis long-term, or long-term lung damage. So a lot of patients are ending up with residual shortness of breath, and the question arises, is this heart or is it lungs? A lot of patients are losing their sense of taste and smell for long periods of time. A lot of patients are ending up with a foggy sensation neurologic fogginess. So there are a lot of consequences of having COVID-19 that are not good for the long run, no matter what age you are, and something really to be avoided.